In February 2026, partners of the European project SIMPECT gathered in Kranj, Slovenia, for a study visit dedicated to long-term care systems and the challenges linked to an aging population. Like many European countries, Slovenia is facing the rapid aging of its population, which is increasing the need for long-term care services, both at home and in institutions. We were very warmly welcomed by our Slovenian partners, who shared key figures and insights to help us better understand the national care system. The Slovenian system is currently in transition, with a new legal framework aiming to improve access to services and strengthen home-based care. However, several challenges remain, including staff shortages and the fragmentation of services. At the beginning of the week, partners exchanged perspectives on the journey of people experiencing a loss of independence. French partners presented the GIR scale used in France to assess dependency levels, opening the discussion on how different countries organize care and support systems. One of the highlights of the visit was the discovery of the public nursing home of Kranj. This center brings together several services in one place: residential care, a day care center, home care services, and even meal delivery for elderly people living at home. This integrated organization allows professionals to support people at different stages of their lives and adapt services as their needs evolve. During the visit, we also met with care professionals, nurses, care assistants, social workers and activity coordinators, who shared their experience and explained that many essential skills in care work are developed directly in practice, through mentoring and field experience. Partners also discovered innovative initiatives within the Slovenian care system. The Institute for Long-Term Care plays an important role in coordinating and developing the national long-term care system. We also learned about Heroes at Home, a platform that organizes home care services. This model is based on an individualized approach. A social worker assesses the person's needs, prepares a care plan and coordinates visits with families and local services. At the end of the week, partners took part in a co-development workshop to reflect on what had been observed during the visit. The group worked on a Slovenian challenge: the lack of bridges between generations and aging craftsmen who have valuable technical knowledge but do not always know how to use these skills in elderly care. Through collective discussion, participants explored ideas to better connect generations and recognize existing skills that could contribute to supporting older people. The week also included many informal moments. One memorable experience was when a member of the local chamber invited the group to board his beautiful vintage bus and drove us to dinner, a unique moment that perfectly reflected the warm hospitality of our Slovenian hosts. The visit concluded with a shared moment in Bled, a truly magnificent place surrounded by mountains and a beautiful lake. In this inspiring setting, partners continued informal discussions, reflected on the week's learning and strengthened their collaboration.